Snoring's a really common problem that lots of people have got. So what are some of the things you've seen people try to help with their snoring?
Yeah, well, I've seen almost everything that's out there, really. People generally will try things, especially if they're inexpensive and simple. So you go to the chemist or you go online, there's just so many different things available for snoring. A lot of people have tried it. I mean, you can see this particular patient, I've got a picture here of a patient who came to see me, and this is pretty typical, where they just pull out these things from their handbag as what they've tried. And you can see this person's tried 3 things. An interesting thing is the ring that they've tried. So you can see there this thing called a Snoring, and I find that a really fascinating type device, which is supposed to work on an acupressure point. And the ACCC have stopped them advertising and making claims. And interesting, I read the ACCC report, and they've sold over 300,000 rings in Australia, and they're about $50 each. So there's a lot of people out there, and they've claimed that it's been recommended by physicians, but when they were asked, there was no physician that was recommending it at all. So they're the sort of things that we've gotten, and you can see here, this is some of the things that's available. Like there's a spray that you can get from the chemist. So you just spray it at the back of the mouth and it lubricates, and somehow it's supposed to stop snoring. That there's lozenges, these are herbal lozenges that you can use. I mean, hopefully they taste good because it's not going to do much else. No. And then there's things you put on your nose, on the outside of the nose, up high, to supposedly reduce the snoring. And chin straps are quite common as well, which the aim here...
That's one of my personal favourites. It gets marketed pretty heavily on the internet.
Yes, so it goes like that. And supposedly this stops the snoring. Do you think there'd be much success with this or not?
No, and particularly, when we think about how oral appliances work, we think, or we know, they work by bringing the lower jaw forward. So something like a chin strap that's going to be pulling the lower jaw back, it's not going to be helping, and if anything, may make things worse.
Exactly, and can cause some jaw problems as well. So people try all these devices, and generally there's been some studies showing that they don't work, basically because the problem is very much anatomical, mechanical at the back of the throat.
Yeah.